Hello everyone, welcome back to my channel Budding Homeopath. In today's video, I will be discussing with you all about homeopathic pharmacy. For the BHMS course, the Bachelor of Homeopathic Medicine and Surgery, in this course, in the first year, you have one subject named as homeopathic pharmacy. Homeopathic pharmacy is very important and crucial subject, though it is placed only for 1 year. You have to read it only for first year BHMS. And then when you are in MD, you can choose homeopathic pharmacy. But the why this is so important and crucial to learn homeopathic pharmacy? Because it deals with drugs. Now you will be confused between materia medica and homeopathic pharmacy. See, in the materia medica portion, you will be learning about the symptoms so that you can select the remedies, you can choose the remedy. But in homeopathic pharmacy, things are little bit different. Here, you have to learn about the potencies, about the mother tinctures, mother solution, trituration, and so many things. But before that, first you have to learn the basic about homeopathic pharmacy. Now let me tell you that some of the students get stuck at all these types of basic things. But if you don't skip my video, I can assure you that you will learn it very smoothly. Okay, myself, first year BHMS student from India, West Bengal. Okay, let's start. What is homeopathic pharmacy? Very important question, but just the basic. What is homeopathic pharmacy? It is an art and science of identifying, collecting, preparing, preserving, standardizing, and dispensing of medicine. Now, let me tell you one thing, that you have to tell all this, means you have to maintain the sequence. First, you have to identify, collect, prepare, preserve, standardizing, and then dispensing. So, this is very important. If you change the order, let's say first you are saying it is an art and science of standardizing, preserving, dispensing, collecting, it will be wrong. Okay, so the sequence must be in order, because if you cannot identify, you cannot collect. If you cannot collect, you cannot prepare. If you can't if you don't have the preparation, if you don't have the drugs or the medicine, then you cannot preserve it. Okay, so all the things are very like in order. So you have to remember this definition in order. Okay, you cannot forget the definition here. You cannot change the, you cannot alter the orders here. Okay, it also deals with the legal and professional aspect of regulation of proper distribution of the medicine. Pharmacon. Remember, this is not a C, okay? It's K, pharmacon. It's a Greek word. It means a drug. Now, next important question: sources of homeopathic pharmacy. Sometimes students get confused between materia medica and homeopathic pharmacy because some names are very common. Okay. Also some organ on part. Okay. So don't get confused. Just learn it very easily, very smoothly. Sources of homeopathic pharmacy. Essay on a new principle for asserting the curative power of drugs. And then this name is very tough. But let me tell you, if you remember it, if you just read it out 3-4 times, it will just set on your mind. Okay. Fragmenta the vidivas medicamentorum positivissive insano corpore humano observatis. Okay. 1805. So, what is the name? Fragmenta the vidivas medicamentorum positivissive insano corpore humano observatis. It is the first collection of drug proving. Okay. Now remember one thing. In other medicines, for example, in allopathy, okay, in allopathy what they do? They prove on animals. But in homeopathy, remember, since from the very first time, means the ancient time, we were proving all the drugs on healthy human beings. Remember, healthy human beings. I will come to you why healthy human being is like why it was proved on healthy human beings only. I will come to that point later when we will be learning about the terms of drug, medicine and remedy. Okay. But for now, just remember that it is the first collection of drug proving and it contains 27 drugs. This data is very important. Okay. And let's say if there is any short note on sources of homeopathic pharmacy, definitely you have to mention this fragment of the Vidivas thing. But if you mention that this also small information, it will be good. Okay. Then the Lizer writings, the organ of medicine. Remember, for organ of medicine you have 6th edition. Okay. First edition was published in 1810 and then second edition 1819, third edition 1824, fourth edition 1829, fifth edition 1833 and sixth edition 1921. Now, all these are very important for Viva, for organon of medicine Viva. Okay, these the editions part and especially the names, the first and second names, the changes where chronic disease in evolved, where not, and also the vital force and where the drug dynamization. All these are very important, like the crucial parts of the editions. Okay, and also the aphorisms, how many aphorisms were present in first edition, how many aphorisms were present in second edition, third edition, like this sixth edition. Also one more important thing, that translator of the fifth and sixth edition. Okay, so all these are very important question of your organon of medicine. So if you learn this, if you memorize this, like the source of homeopathic pharmacy, some questions of your organ are all automatically solved. Okay. Materia Medica Pura. Okay. So these are the volumes. Now the chronic disease, their peculiar nature and their homeopathic cure. So all these were the sources of homeopathic pharmacy. Now remember, every time you have to note homeopathic pharmacy, because pharmacy is different and homeopathic pharmacy is different, and we are studying homeopathy, so homeopathic pharmacy. Next question, very important, branches of homeopathic pharmacy. For your Viva, for your exam, it's very important. Okay, so branches of homeopathic pharmacy: Galenical pharmacy, proper pharmacy and other pharmacies. So in proper pharmacy, it is divided into two. One is official and one is extemporaneous. Okay. So Galenical pharmacy, it implies the pharmacy that follows the method and queries of Galen. It's so simple. See, Galenical pharmacy. So from this term only, you can get the Galen word. Okay. So by this, you can just remember, okay, it was, this method was given by Galen. And then we'll come to proper pharmacy. The official pharmacy deals with the rules and regulations and the preparation of drugs according to official pharmacopoeia. Now, what is pharmacopoeia? Okay, we will come to it next. What is pharmacopoeia? But for now, just remember that official pharmacy deals with rules, regulations, and the preparation of drugs according to official pharmacopoeia. Now, let me tell you that this pharmacopoeia spelling is very tough. So you have to make you have to just pay huge attention to this spelling, because also the homeopathy spelling also you have to pay a very good attention. See, homeopathy. Okay. So and also the pharmacopoeia, COPOEIA, pharmacopoeia. Okay. And then the extemporaneous pharmacy, it consists of preparing and distribution of medicine according to the direction of physician, and it is done at dispensary level, means when the patient is there, the doctor is there. Okay, at the dispensary level. And others pharmacy, theoretical pharmacy, it relates to teaching in academic institution and their theoretical nature. Wholesale pharmacy, it is a link between the manufacturer institution and pharmacist, and Communicable pharmacy, operative pharmacy, it relates to various aspects of standardizing, manufacturing, retail, administrative, and hospital pharmacy. Okay. And institutional pharmacy, it is the practice of homeopathy in private, in government owned hospitals, health maintenance organization, homeopathy medical college, and nursing home. Clinical pharmacy, it is patient oriented pharmacy which includes dispensing of required medication and advising the patient on proper use of all medications. Okay, so these were the branches of pharmacy. um, this these are not so important. If you just read it, okay, but the official pharmacy and the branches basically you have to remember, okay. And it will be great if you already memorize all these, you know, the definitions. Now let's come to homeopathic pharmacopoeia. Very important. I have already put it in red bold use, so you can see. Homeopathic pharmacopoeia, very important for your viva questions, for your first term viva question, and also for the examination in first term, like in the PA and also in first term. Pharmacopoeia, pharmacon means, as we already discussed, a drug, and poenin means to make. A drug to make. It is the supreme authoritative book published by the authority of government of any country that deals with the rules and regulations of standardizing of the drug substance. So, what is pharmacopoeia? Pharmacopoeia is the supreme authoritative book published by the authority of government of any country that deals with the rules and regulations of standardizing of drug substances. It contains direction for collection of drug substance from different sources. Now, when we will be discussing about the no source or codes and so on, there are so many things. We will come to it later. The different sources, their preparation, preservation, and standards that determine the strength and purity. So this is all about the pharmacopoeia. It means it is a book that deals with the rules and regulation of standardizing of drug substances, and it contains the direction, means how to. It is the it's showing the route. It's showing the path for collection of drug substance, means how to collect it from different sources, their preparation, how to prepare it, how to preserve it, how to make it very standard, and for determine the strength and the purity. Okay, now this pharmacopoeia has two branches. One is official pharmacopoeia and another one is unofficial pharmacopoeia. Okay, now, what is official pharmacopoeia? These are very important, very important. You cannot skip, you have to memorize it. So, what is official pharmacopoeia? It is officially published by the authority of government of a country or any medical or pharmaceutical association authorized by government. It means either directly or indirectly it is related with government. Either it is officially published by the authority of government of a country or any medical or pharmaceutical association authorized by the government. It means it is all about related to government. It is connected either directly or indirectly. Example, HPI, Homoeopathic Pharmacopoeia of India. HPUS, Homoeopathic Pharmacopoeia of the United States. And in later part, you have to learn about HPI, HPUS, German Homeopathic Pharmacopoeia, and so on. Okay, so we will come to it later. Now, unofficial pharmacopoeia, it is a book published by any person other than authority. Okay, so if I myself want, I can just publish a book and I will be naming it as pharmacopoeia. Okay, so it is a book published by any person other than an authority. So that's why it is written as unofficial. Okay, and the other thing was written as official. Okay, see, official pharmacopoeia and unofficial pharmacopoeia. I hope it's now clear. And examples: HP, American Homeopathic Pharmacopoeia, Pharmaceuticals Manual, and there are so many examples also. The M. Bhattacharya, you can also mention the M. Bhattacharya. Okay, drug. What is drug? You have to make it very clear what is drug, what is medicine, what is remedy. Okay, and what is the difference between cure and treatment. After that, in the next video, we will be discussing about history and development of pharmacopoeia. So first, let me tell you one thing. Cure means permanent removal of the disease. Permanent removal of the disease. And treatment means recovery. For example, there is one patient came with a complaint of fever. You treat the patient for 2-3 days, fever is gone, and then again fever came. So you can see that some disease is coming twice. So we can say it is a treatment. The treatment was done, not the cure. Okay, but in today's days, 100% cure is very rare. It's also true, 100% cure is very rare, but not impossible. Okay, so cure means permanent removal of the disease. For example, smallpox. Okay. Anyways, now let's come to drug. What is drug? Drug is a therapeutic agent prepared pharmaceutically from standardized drug substance that is sufficiently capable of affecting sensation and function. Now let me tell you one thing. If you want to remember any particular and important definition, you have to first just underline or just mark with highlighter the important and crucial words. You cannot remember 4-5 lines just like that. You have to just mark some words so that the definition will directly set in your mind. Okay? For example, this therapeutic agent prepared pharmaceutically, standardized drug substance, and sufficiently capable of affecting sensation and function. Why these are important? Because a drug is all about this. Okay, see, we have also another definition. A substance collected from any source of nature. See, standardized drug substance. See, then prepared according to the pharmaceutical technique. See, prepared pharmaceutically. These lines are important. And on the next area, we can see that and has brought the power to change the state of living organism both in health and disease. Has brought the power to change the state of living organism both in health and disease. Same thing written here, sufficiently capable of affecting sensation and function. Here it is saying that has brought the power to change the state of living organism both in health and disease. It means you may learn about Syncona for the Hahnemann for the malaria part. Okay, it means as the homeopathic principle is similia similibus curenter. So if let's imagine I am a very healthy person. Okay, I am very healthy person, and I take medicine of similarity, let's say fever. Okay, now what will happen is feverian symptoms will produce. It means I will get fever. And let's imagine I have already fever. and I am taking the medicine of fever, and then what will happen? The fever will be gone. So that's why it is saying that and has brought the power to change the state of living organism both in health and disease. For example, Nux vomica mother tincture, belladonna mother tincture. This is the example. This is the symbol of mother tincture. Okay, Nux vomica mother tincture, belladonna mother tincture. Whenever you are giving an example of giving a definition of drug and giving an example, you have to mention about the mother tincture. Okay, belladonna mother tincture, Nux vomica mother tincture. You can say any other medicine, any other drug also. Okay, but you have to say the mother tincture word. And what is medicine? What is the purpose of medicine? The purpose of medicine is drug proving. Okay. Now see, which I was discussing previously. When a drug has been proved on healthy human beings of both sexes, all ages, constitution and subjective objective changes are noted, it is termed as medicine. Okay. When a drug has been proved on healthy human beings. Now again I am saying these are the crucial word. Has been proved on what? Human beings. Healthy or unhealthy? Healthy. Has been proved on healthy human beings of both sexes, means either males or females, of both sexes of all ages. Constitution, we will come to it. What is constitution? And subjective or objective changes are noted. What is happening after giving the drug? What symptoms are producing and all. So subjective and objective changes are noted. It is termed as medicine. Okay. So that's how we can learn about the symptoms of any particular medicine. For example, belladonna 30 or belladonna 200. Okay. So if now we say belladonna mother tincture, it will be a drug. Okay. So belladonna 30 or belladonna 200. Remedy, purpose, cure or treatment. When a medicine is administered to a patient according to the similarity of symptoms to achieve a perfect cure, it is called as remedy. For example, will be same as drug. As medicine. Example, belladonna 30 or belladonna 200. So, the purpose of the remedy is to get cure or treatment. Cure is very tough in today's days. When a medicine is administered to a patient according to the similarity of symptoms, this line is very important, this word is very important. Administered to a patient according to similarity of symptoms to achieve a perfect cure, it is called remedy. Okay, so bye. Stay tuned to my channel. I'll be discussing in next video. Okay.